Felony review course. For me, I studied the review manual you can buy from the Society of Trauma Nurses, and then I went in and took the exam. For me, who did a paper and pencil state boards 40 years ago, that was really enlightened to me. And it was really pretty rewarding because you find out immediately when you leave the testing center, and you get to pick the time of day and the day of the week when you take the exam. So the best way we learn is by actively participating, sitting and listening. And I know this morning that was lots of good content, but a long morning. So I need 3 volunteers. I need 1 person to keep score. Okay, you're my scorekeeper. What's your name? Marissa, come on up here. There's the scoreboard right there. And I'm going to divide the room in half right here where the camera is. So, and you guys down the end, come on down for this hour. Come on down so we can all participate. And this side can move down a little bit. Then I need somebody on the left-hand side of the room. You're the shock group. Who wants to be the spokesperson? So we're going to give you a question, and then you're going to come up with an answer as a group. One of you needs to tell me the correct answer. Who wants to do that? You're going to get a prize, by the way. Okay, so you're the spokesman. And you're right there, you're great. A spokesman for this side of the room gives the formal answer.
It's a good prize. It's not just like a pen. Who wants to be spokesperson?
Come on, somebody on this side. Speak for the group. You don't have to know the answers. You're going to page the. You're going to
work together, so you just have to actually say it out loud. So you're going to work together.
Okay. Did you? Yeah. Okay. We got it. So we have Marissa, and we have. What's your first name? Jackie. And then who's my captain here? What's it? Dominique. Okay. Okay. And I'm good right now for a little while. Okay. So let's see. So here's what we're going to do. Let's see. Okay. Right. Let's move the slide. So we titled this game TCRN Jeopardy. Now, as you know, in Jeopardy, the faster you answer the question, but that's not what we're going to have. There's going to be no Ken Jennings here. We're going to go back and forth. So my 2 spokespersons, Jackie and Dominique, you need to tell me, pick a category and an amount of money, and you're going to be writing down how much money. You get bragging rights at the reception tonight. I was on the shock team that won. I was on the trauma team that knew the most answers. So, go. Shock's on this side, trauma's on that side.
You pick a category, just like Jeopardy, you pick a category and
So,
an amount.
shock, pick a category and an amount. I'm not even going to sit down because I got to stand tonight again. So, give me an amount and a category so I can give you a question.
Burns. Just musculoskeletal burns. How much?
And the easier questions, they do get harder.
What do you want to do? Thoracic. Thoracic for how much? 100. Right.
Hey, you know what? That's not going to work. Go ahead. Read the question.
Oh, yeah.
This bruising of the lung can blossom and cause significant respiratory compromise.
Pulmonary contusion.
Correct. So you get 100 points. Trauma side. Pick a category and amount. Category and amount. Quickly. Come on.
You can't see categories.
Thoracic, abdominal, neurologic, oral, maxillofacial, GI, GU, OB. Burns. How much?
Pain. Pain on passive motion. Pain not relieved by narcotics is the classic sign of this orthopedic complication. Excellent. You learned that this morning from K-Ray.
That's my nickname, by the way.
Okay, category and an amount over here, folks.
We will do thoracic again for 200.
Thoracic for 200. A belted driver T-mode on the driver's side is most likely to have damage to this abdominal organ.
What is spleen?
What is spleen? That is correct. And intrusion of greater than 4 inches of the car panel into the side makes it more likely. Okay, Trauma side, pick an amount in the category. This radiographic sign is an indicator of a pneumothorax on a supine chest x-ray. Got to get NPs in the group? Anybody with advanced practice?
You can see on that x-ray.
So they're laying flat on their back, and you get this x-ray. If they don't get it, we'll give them another minute. Be patient here. You had your gumbo and your fried chicken and your catfish. We know what you got. We're all eating the same thing today. You want to come up with an idea? Does Shop want to try to steal this one? No, turn those phones off. Put them away. You may not. This is not Who Wants to Be a Millionaire. It's not a 50-50. We can't call a friend. That's a different game. But we've played that game too. Okay, we'll give nobody gets any points here. What is a deep Solstice sign? Do you want to explain that, K-Ray? Yeah, just for 1 second. Tell them what it looks like.
So what you're looking at here is, remember, when you're lying supine, where's the air going to go? Yeah, so you're going to see it down here in the base, is right there above the diaphragm, right? You sit them up, right? That's when you're going to see the one clock for the air rise.
When you sit them up, but if you're starting with the flat chest x-ray, you're not going to see it. So you didn't get it, you challenged but didn't get it, but it's still Shock's turn.
You guys all hear me? I'm pretty loud, so.
Okay, category and amount, Jack.
We're going to choose thoracic for 300.
Thoracic for 300. These are the signs and symptoms that describe the injury. Flat neck veins, absent breath sounds, percussion dullness, hemorrhagic shock, and respiratory distress. Jackie, you got an answer there.
Okay, what is tension pneumothorax?
Actually, it's a massive hemothorax. Pneumo would not be dull because it would be hyperresonant because of all the collapsed lung. But when that's actually not correct. So it's massive hemothorax. Pneumothorax, you won't actually get hemorrhagic shock until it becomes obstructive shock, because when you have the dreaded mediastinal shift. So, but when you're bleeding into the lung, you're going to get like 2 liters of blood in that one lung. That's the difference. That's okay, but we're going to get then trauma. You got a chance to take the lead here. You want to put on them out in the category? Burns. Burn Center's here. Burns for 300. Oh, yeah, go back. Can we go back? Oh.
300 OB. Or it's
No. It was they wanted to do burns.
They changed it last
Oh, okay. Changed it last minute. You guys are challenging here.
They want OB.
This is a sign characterized by bruising over the posterior aspect of the 11th or 12th rib or flank, and is associated with the presence of renal trauma or retroperitoneal bleeding. Let's bring up the answer. They're saying, what is Gray's Turner sign? Excellent, excellent job. Back on Shock side, pick another category and amount. Just to let you know, you're absolutely right. It's hard to see the categories. We probably should have had the titles in white also. This morning with Ken's slide, the white on the pink, sometimes it's a little hard to see. You can't master them better than nicer AVs here, though, I'll tell you that. The projection here is excellent. So, category and amount, Jack. This injury pattern, often diagnosed greater than 24 hours after injury, occurs more frequently on the left side and is related to high-speed blunt trauma or penetrating trauma. I will tell you this, I've probably only seen 12 in my career of 40 years. I'm going to give you a little hint. They actually will tell you that you'll hear bow sounds in the chest. What is diaphragmatic rupture? Absolutely. And I'll tell you positively this, you're never going to hear bow sounds in the chest. Because if your bowels have migrated into your left chest, they've been slacked around and they are not going to be working. There's going to be no peristalsis going on. First time I ever saw it was a patient that was transferred from Gettysburg Hospital to Baltimore. He had bilateral chest tubes, and in transport they had Y connected them to one drainage system. So yeah, you're doing this one of the best care, right? So because now what side of the chest is bleeding, the left or the right? We don't know. And the left chest, from our initial chest X-ray, his bowels were in his left chest, but all his lacerations and contusions, that's probably 36 years ago, were plastically repaired. So did they have their ABC straight? No. They were billing, I'll tell you that. Okay, shock's got a trauma. Give us a category and amount. Burns for...
We already did that one.
Oh yeah, we did that.
That was my mess up, sorry.
This type of amputation has the highest potential for reattachment. No, we already had that one. Oh, okay. We got a couple questions that don't match. Quickly now. We don't want to have to let them steal. Actually, it's guillotine. If you have somebody that it's not industrial, that's crushed, the chances of reattachment are not good. But if it's a nice slice, like I was telling people at lunch, my husband sliced his fingertip off. Quick clot works, I'll tell you that. Oh, I had private access to it at the time. Okay, so come on, Trump Shop, you got a chance to really. What's the score here? How we doing? Shock is winning. Woohoo! Bragging rights. You only have to get an 85% on the test in order to get your certification. It's valid for 3 years. You have to. There's nothing accreditation-wise you have to do, and you might want to check into it because your hospital might give you a little chunk of change. Category and amount, Jack. Thoracic for 500. Up to 80% of this type of hemorrhage is related to blunt pelvic trauma. Yeah.
What is hypovolemic shock?
I heard another, that's not correct.
Retroperitoneal.
So retroperitoneal, absolutely. That's the place you can bleed to death. From a pelvic fracture, you're going to bleed because it's going to just keep expanding. And when the retroperitoneal feels, if you're a gentleman, where is it going to slowly migrate? Down to the scrotum. Scrotum's as big as basketballs. So you will bleed to death from a pelvic fracture unless you stop it. Well, the first answer wasn't right, so I think no, but we can't. But you didn't get a chance to steal. Trauma, let's get another category and amount. GIGU for hot, she's going for the gung-go. This medication is administered to facilitate the excretion of myoglobin through the alkalization of the urine. I'm emphasizing the word alkalization. Well, that was one that Kay-Ray mentioned this morning in her presentation. But that's not the mechanism that works. So I'm going to give you a chance to give me a better answer. Because you're prejudiced by her. I mean, we got a competition is good, isn't it? But you want to give you guys a chance to steal? Okay. Go ahead, show them the answer. It is sodium bicarbonate. So the mechanism is different. With mannitol, it has to do with osmolarity and the size of the molecule. In this case, it has to do with changing the pH of the myoglobin.
Do I give them the point?
Your call. No, I don't think so. Because we're actually not competing. You're trying to decide whether you need a review course, where you want to spend $40 on a book, or you just want to sign up and take the darn exam. If you're getting most of these correct and you've practiced for more than 5 years at a trauma center, I think you're ready to take the exam. It's not like the NCLEX. In the NCLEX exam, you start with a knowledge question, and then as you know the knowledge, there comes application, right? So it's not what are the signs and symptoms of an abruption. It's a patient does crack cocaine and comes into labor and delivery and says, I'm not feeling my baby move. And what do you think she has? This test is very much knowledge-based. It's not as much application. Don't overthink it. They won't tell you, they'll tell you your score, but they won't tell you what questions you got wrong. I'm convinced I got the trauma and pregnancy question wrong because I overthought it. Okay, where are we now? Back over here at trauma? No, shock. Come on, shock, category them out.
G-I-G-U-O-B, 400.
Oh, okay, well, I make it. This injury would be expected in a 36-week pregnant patient who's been in a motor vehicle crash, complaining of severe abdominal pain and presenting with vaginal bleeding and a rising fundal height.
Do you all agree? Yeah. What is uterine rupture?
Not correct. Okay, so what's the difference? Placental abruption is the most common unique injury. The placenta pulls away from the uterine wall and begins bleeding. That's why the uterus gets higher. That's why we have rising fundal height. That's why field providers, if you have a Sharpie, mark where you feel the top of her abdomen. And then if she gets to the hospital or if she's being resuscitated, it's rising. That's sign of abruption. Uterine rupture, which can happen to anybody that's had multiple C-sections that goes into labor also. You're going to palpate two masses, the uterus and the fetus. Back over to trauma side. Pick a category them out. This tripod-shaped fracture includes the central maxilla, the nasal area, and the ethmoid bones, and may be associated with subconjugal hemorrhage. Need a formal answer from trauma. Lafort's, yeah. So it's actually Lafort 2, but I think they gave an adequate answer. And Lafort was some French guy that took a bunch of old skulls that he dug up out of the cemetery and smashed them with like a baseball bat. I don't think baseball had been invented yet. And injury patterns, that's why mechanism of injury is so important, finding out what the real story is, because the patterns of injuries match mechanisms. I think it was 400. Woohoo! Are they coming in? Are they getting there? Good, good. Shop, go ahead.
Wild card, 500.
Good. This condition can develop in patients on long-term TPN and is associated with a higher rate of gangrene and perforation in the gallbladder. Now we're flipping into critical care territory here, folks. Okay, I'm gonna start humming this Jeopardy theme pretty soon. Does Shock? Do you have an answer, or trauma? Do you want to try to respond here?
What is pancreatitis?
It's acute calculus cholecystitis, which is a little different. The gallbladder's involved.
It's like gallbladder.
Yeah. All righty, back to trauma side. What you can do is have like a little lottery